Hey everyone, good morning, good afternoon, good evening, wherever you join us today. Thank you for joining MSL Pediatric Days. Here is Mazin, Elmahi, Omar, public health specialist working with Save the Children now, but in past with Norwegian Refugee Council. And I want to talk about the psychological impact of displacement on Sudanese children in Qadarif, which high prevalence of trauma and anxiety among displaced children. So in 15 of April 2023, war was started in Sudan, created one of the largest displacement event in the world. So this forced about 10 million to flee their homes and living as IDPs in other states and as refugee in other countries like Egypt, Ethiopia, Uganda, South Sudan, Libya, as well as Ethiopia. So five of these 10 millions are children and which are high vulnerable to trauma, loss, and chronic instability. Al-Gadarif, as I said, was safely state and was not affected directly by war. So there is massive inclusive of IDPs, which the uh, authorities they are managing through informal and overcrowded collective center, and you can found mental health psychosocial support and infrastructure in overcrowded collective center that you found it in formal camps. So overall objective of our study is to provide validate quantitative evidence on psychological needs to justify the immediate redirection and increase of protection and health sector funding. So the methodology was designed descriptively across a sectional survey among children between age 7 and 18, 18 years in living from IDBs living in Al-Gadarif, in IDBs camps, and we collect data through interviewer administrated questionnaire using validated symptoms checklist for clinical significance, and we focus to assess the three prevalence of three key conditions: post-traumatic stress disorder, number two, anxiety symptoms, and the third one, depression symptoms. And we collect data from key data like symptoms burden, psychodemographic like gender, education, and specific traumatic event history like lost their parents and loved one. So we found quantifiable burden like immediate threat from for PTSD. 36 to 40% of displaced children face PTSD, and in every 10 children, you find four of them need require specialized structured mental health psychosocial support intervention, not just basic psychological need. Also, we found widespread stress, anxiety, and sadness, like 73% of children frequently felt anxious, and 68 of children frequently felt sad. So there is reported or some symptoms reported like intrusive memories, nightmares, avoidance behavior, which is severely disrupt learning, sleep, and social reintegration. Also, from findings that we found it qualitative impact when Muhammad said, when the track passed at night, I woke up screamingly because I think the shooting has started again. I haven't slept properly since we left our home. So this like human cost affected by this psychological service. We identified also some groups and some vulnerable groups need or targeting mental health psychosocial support. For example, female gender is we found like higher incidence for anxiety and PTSD, post-traumatic stress disorder. Also, for those who lost their parents or loved one directly linked to trauma, and also the level of education for parents. This reduces the capacity of household resilience and support, or affected on resilience and support in the family. Also, there is some other factors worsened the chronic stress like prolonged displacement, food insecurity, and lack of essential wash surfaces also affected the mental health service. So the scaling of mental health psychosocial support, as we all know, mental health psychosocial support is not a luxury, it is life-saving, and this percent from 36 to 40% that indicates there is insufficient of psychological service, and we need to integrate the clinical care through three action. Number one, capacity building. We need immediately to train healthcare worker and community workers on the WHO stupid care model and guidelines to enable early identification and referral cases or severe cases. Action number two, we need targeted delivery through established mobile mental health psychosocial support teams to reach high risk areas and target groups and combined and separating children and female headed households. This like high risk area and targets group, we need to reach them through mobile uh, MHPSS teams. Also, the last one or the last action, we need to link protection with other service to ensure the psychological support environment is also physically safe. So we need to protect our staff, we need to protect our beneficiaries, we need to protect all in the camp. The urgent recommendation or call for action, we need MHPSS intervention, we need financial support, we need humanitarian access. We need to move mental health psychosocial support from secondary activity to core humanitarian response or to core. Also, we need financial support from international community to increase financial support for Sudan to address the chronic needs now. And we need humanitarian access. We need to unimpeded humanitarian access, secure, consistent, unimpeded humanitarian access to all vulnerable population, particularly those displaced in host community. In conclusion, the crisis in Sudan has evolved from a physical security emergency to protracted humanitarian and psychological catastrophe. catastrophe. So the data from Al-Qadarif provided a clear mandate. We must act decisively or directly to protect the mental health, or we must act urgently to protect the mental health of this generation, of these children. Finally, we have a validated tool and we have operational framework and our national initiatives is ready and we just need and require the political will finding commitment to implement. There is war, there is malnutrition, as you see and observe. There is disability, but also we have a hope. There is some organization work to release children negative energy by involving them in reaction programs. So this some reference you can check it throughout this and look forward to connect with all of you. Please just scan the QR code to find my connect details and will be happy to connect with all of you. Thank you again.